Good afternoon, everyone, and welcome to our virtual town hall for today, October the 15th, 2020. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Happy to moderate, as is normally the case, these town halls. We'll have a Q&A at the end of our presentations and as well an opportunity for some celebrations. So when that moment comes, you'll have a few different ways that you can ask a question. You can raise your hand in the participants box and we'll call on you to ask your question live. You can also pose a question to anyone in the group via the chat function or the Q&A function, and we'll call on the raise your questions in the order that they're asked. And same goes for celebration. So always prefer the real voice, real person mode if you can swing it. If not, then I'll be happy to read your question out. So first, I'm going to call upon our President and CEO, Rob McIsaac, to give us a little bit of a bird's eye view about what we'll be talking about today and some important things going on in the organization. So Rob, over to you.
Thanks very much, Aaron, and good morning, everybody. As always, I want to start by saying thanks to everybody for making time today to attend. And more importantly, as always, thanks for all the work you're continuing to do in helping HHS fulfill its mission for the communities we serve. I think healthcare is never easy, but in the context of a global pandemic that is stubbornly persisting in our community, in our province, in our country, I think the work everyone is doing is extraordinary. So thank you very much. As always, as Aaron mentioned, we have a few updates to cover today regarding what's going on in our hospital. For starters, though, I'd like to take a moment to address a very important issue that I think has shaken many healthcare workers and Canadians over the past few weeks. On September 28, Joyce Echaquan, an Indigenous woman from the Atikamekw Nation, was subjected to racially discriminatory treatment by her healthcare workers as she lay dying in a Quebec hospital. Joyce's experience was captured on camera and made public. The video capturing her suffering and the verbal abuse she endured was horrible to watch. This event has fueled discussion about racism in Canada, a discussion which I think really started again in earnest over the summer because of events that happened internationally. It's more particularly, I think this event has really fueled discussion about racism in Canadian healthcare. I'm sure all of us at Hamilton Health Sciences hope that an event as shocking and tragic as this one would simply never happen here. But Joyce Echaquan's experience proves that we can't assume away or simply hope for the best when it comes to the subject of racism. In recent months, we've heard from several patients, staff, and physicians who have felt impacted by racism and discrimination at Hamilton Health Sciences. I want to say that Hamilton Health Sciences has been doing good work in the area of human rights, and for a long time. We've had a relatively small but very effective team advancing our thinking and our practices. So we aren't just waking up to this as an institution, but given all that's been happening, I felt it was important to put a special focus on this work, and that's why earlier this year, we decided to assemble a corporate equity, diversity, and inclusion task force with the goal of tackling racism and discrimination within our hospitals. Bruce Squires, the Vice President of Women and Children's Health, and Dr. Sanjay Sharma, critical care physician, have been tasked with leading this initiative. Recruitment for membership recently wrapped up, and I'm really excited that the work of this group will get underway in earnest in the next short while. They will have a difficult task ahead of them, but it's work that needs doing. My thanks to all who will contribute to this as we go forward. I have to give my apologies this morning as I cannot stay for this whole session. I have another meeting that was scheduled that I have to attend. So I am going to sign off shortly and ask Aaron Levo to host the balance of the meeting. But again, thanks all for attending. And with that, I'd like to turn the meeting over to Bruce Squires, who has an update for us about virtual care at Hamilton Health Sciences. So over to you, Bruce.
Thanks very much, Rob. Maybe before I do speak to virtual care, I'll just take this opportunity to thank you, Rob, for what you just said with respect to the situation with George Chauvin, and with respect to the Equity, Diversity, Inclusion Task Force that you have created. I know for Dr. Sharma and I, we see the task as being monumentally important, and so we're both honored to be permitted to be part of it, but certainly also humbled in that request. Many folks have volunteered to be part of this effort, and our intention is to engage and involve every single one of them. So I suspect we'll have many more opportunities to use this venue and others to talk to you, the people of HHS, about that effort going forward. So I look forward to those opportunities. Turning to virtual care, I've got kind of an exciting announcement here. So we all know that as we pivoted the early stages of the pandemic to virtual care across HHS, it was amazing the rapid adoption we saw. As we tracked it, we realized 1,000% plus increase in our use of virtual care. And that quick accelerated adoption, it allowed us to continue to deliver high quality care to our patients, while at the same time protecting necessary capacity in the event of it was required. As we've listened to feedback from staff and from physicians and patients, I think we've all heard of many successes, but also challenges that accompanied that rapid pivot. We're now, of course, entering a second wave of the pandemic. We don't all know exactly what that's going to look like, but I think we can all safely assume that virtual care is critical, not only to the pandemic, but to our long-term future. So in that vein, I'm pretty excited to announce that we are launching a virtual care operations team, launched under Lucas Milinovic, a director in ambulatory care and community care, and we'll be doing a communication on that in the coming days to really share the details. But I can tell you a little bit. The team's led by Kara Langdon, who's the new manager now of virtual care, and at a high level, the mandate there is to help us to create a succinct and clear enterprise approach to virtual care across the organization. And to what end? Well, to support the seamless delivery of high quality care to the patients and families we serve. In terms of sort of the next 6 months, the team has a few priorities. They've been shaped to a large extent by the work of the Ambulatory Care Task Force. And of course, much of our ambulatory services really did shift to virtual care. That task force has now asked the team to really focus on a few things. One, of course, is developing a standard approach and kind of exemplary or best practices to virtual care at HHS. That's focusing on improving our processes and reducing barriers to adoption. Secondly, the team is going to support 4 really active, focused pilot projects at sites across the organization that have been identified by the Ambulatory Task Force, but they give us a real opportunity to explore what works, what's required to enable, again, that best best expression of virtual care. And a third piece, and this important, is evaluation. So the operations team has been tasked for ensuring that we're able to evaluate from multiple perspectives how we're doing on virtual care. And of course, a big piece of that is then using it to enable progress and improvement. Really, at its heart, we're committing to developing clearer, more consistent, user-friendly resources for staff, for physicians, and for our patients as we support that seamless delivery. So if we go to the next slide, you know, this work is evolving, and it's going to continue to evolve. And in that evolution really does depend on participation and engagement from so many of you that are part of the HHS team. So, you know, a plea, I guess a call out. If you're an active user of virtual care, if you're interested in being further involved in these activities, if you're interested in specific improvement opportunities, then I'd encourage you to reach out to the team. And, you know, as I close, really just highlight that this is another very exciting and important journey. So, so watch out for further details and for the launch memo in the coming days. With that, I'll turn it back over to you, Aaron.
Thanks a lot, Bruce. So next up on our agenda, we have an update on the United Way campaign. I'm going to call on Donna LaForce, the Executive Director for the Office of the President and CEO, who with some others is leading that work this year. So Donna, take us through this update. What can we expect?
Thanks, Aaron, and good morning, everyone. I am joining you today in my role as co-chair of the United Way campaign. This year, due to the COVID pandemic, our campaign is entirely virtual. However, I'm excited to report that the new format has been fully embraced by the campaign planning team. Despite the changes in the format, the team's pulled together some really creative ways to continue our HHS campaign traditions of very generous giving. All of this year's details of the campaign can be found on the hub. This year, unfortunately, more than ever, our community really needs the support of our HHS family. On behalf of the campaign planning team, I'm really here to ask that staff and physicians consider becoming an HHS payroll donor. If you are already an existing donor, thank you very much for your support. We are asking you to review your amount and maybe consider increasing your biweekly gift. And also you can make, all of us can make a one-time donation to this year's campaign if that's possible. All of this year's online events can be found on the HHS Hub. I encourage each of you to have a look at the Hub and consider participating and maybe bringing a colleague along to join in the fun. The planning team is really hoping that the 30-minute midday bingo and trivia would be a really nice break in the middle of a hectic day for many of us. So this year's campaign is vital to helping our Hamilton community recover from the effects of the pandemic. We have an ambitious goal to raise $100,000. But we know the compassion and generosity of the HHS family, we feel we can achieve that goal. So thank you very much, and we hope to see you at the online events.
Awesome, thanks very much, Donna. So next up, I'm going to call on Kelly Campbell, who's going to give us an update on a new way for us to recycle disposable medical masks. This sounds really interesting, Kelly. What's new?
Yeah, so starting on Monday, across all of our sites, you will be able to recycle your disposable medical mask. This is a really exciting initiative for us, Aaron. We know that globally with the pandemic, thousands and millions of tons actually of medical grade masks are going into landfill. So we trialed at McMaster over the last couple of weeks just to make sure that the boxes were clear and people were not putting other types of waste in the recycling boxes, because that will result in rejection by the recycler. However, we were very successful at McMaster, and we're now ready to roll it out to all of our sites. The recycler will use these masks and make them into plastic building and shipping materials. They're going to be located at staff exits starting on Monday, and that information will be coming out to leaders today and staff on Monday at the same time as we launch Waste Management Week. So we're excited about this as a new initiative. It will help us divert thousands of tons of medical grade mass from landfill. And each box diverts about 300 mass per week, so it's significant. Again, just to remind people though, it can only be the disposable medical grade mass. Can't put any other garbage in there, or the recycler will reject the box and ultimately could cancel the program. So we look forward to your cooperation and really appreciate your efforts to help us recycle.
Wonderful. Thanks a lot, Kelly. That's a great initiative. I'm going to call next on our EVP Corporate Affairs, Dave McKeag, who's going to give us an update on the resources available to help with the return to school and what's going on in that regard in our organization. So Dave, over to you.
Thanks, Aaron. Yeah, it's a very trying time for sure, balancing a lot, and we acknowledge that. And just want to thank you again for managing to come to work and to care for our patients and to work with your teams and to all do the best that we can in this time. We do recognize that you're facing many challenges, particularly with children returning to school, either in home or in class, and monitoring everything daily as to what may be happening in the school setting. There are staff resources that we wanted to draw your attention to on the COVID-19 intranet. We're updating new information as quickly as it becomes available from both public health, other government sources. These resources will be updated weekly. And we have also Tuesday's hub post regarding the recent changes to Employee Health Services COVID testing program. As we are no longer providing tests for asymptomatic individuals, only symptomatic staff will be referred to testing. That's in line with the approach that the government is taking, and understandably so, focusing the testing capacity that we do have in the province on those that do have symptoms. So wanted to call in and frequently to the COVID-19 hub pages for answers to many of the questions that you have. The content will be updating as we go. There'll be, whether it's specific questions or options available to you about childcare or implications for other COVID-related absences, there will be information there to help you. For those that may not receive pay for COVID-related absences, also wanted to draw your attention on September 27th. The Government of Canada did release 2 additional financial benefits, the Canada Recovery Sickness Benefit and the Canada Recovery Caregiving Benefit, of which more information can be found on the Government of Canada website, which link will also be included in the hub for you. So a lot of changing information, a lot's coming at all of us, and we're doing the best that we can to try to make sure that we have it in your hands. Would always encourage that if you do have additional questions, I would encourage you to first speak with your manager, and you can also then speak with your HR business partner. But often questions that come forward are related to specific situations, and your best first question should be your manager. Couple other points to just call out. Staff are reminded that they are also required to report any international travel to Employee Health Services. And from there, we will work through whether self-isolation is required before returning to the workplace. And I guess one last additional point, and it's certainly different than what Rob opened with on this discussion, but it just does go to how we act and behave, and particularly when there can be stressful and trying times. I would just want to call out that there have been some reports of our own staff not treating our screeners with the respect that they deserve. And it's just something that I'm sure it can happen. It can be frustrating. You're trying to get to your floor or your shift, and you're being held up, and you're in line, and it's screening. Screeners are there doing what we're asking them to do, to try to keep all of us, our patients, our visitors, and our staff and physicians as safe as possible within our hospital's walls. So just try to recognize that. And if you do see a screener that seems to be having some challenge with a coworker, perhaps you could just slide on over and just try to cool down the situation a little bit. And let's take care of each other is really what I'm asking for. So anyway, again, a whole lot of information. There's a lot happening, and we're doing our best to provide that in a centralized place in the hub. And if you have any further questions, again, speak to your manager or to your HR business partner. Thanks, Aaron.
Thanks a lot, Dave. All right, I can see there's some questions streaming in here already. That's wonderful news. As a reminder, you can always raise your hand in the chat function and ask your own question live. Or if your audio and video isn't good, you could always just put it in the Q&A box, which is the preferred location, because then I can see them all in one space and pose them in the order that they arrive. And I have a few that we've received too from our inbox, our email inbox for these virtual town halls. So the first question I have is around testing from Yasmin Khalili. Will HHS provide COVID testing for staff's family members as being done at St. Joe's? I see Dr. Stephen, you've popped in and raised your hand. Maybe I can pose this question to you. So over to you, Wes.
Thanks, Aaron, and great question. I think I will spend just a few seconds with a celebration. I know I'm out of sync, but I do want to acknowledge individuals that have been very involved with our assessment center, and that's Sharon Pearson, Lucas Maninovich, and Carrie Lynn Meyer, who actually created the assessment center 213 days ago and have completed 20,000 tests. Initially, the assessment center did 3 groups of people. They did the public health referrals, they did the asymptomatic employees, and the preoperative testing. And so we have stopped the preoperative testing because the low yield, because of the local epidemiology. And we've been doing our symptomatic employees there, as well as public health referrals. So to answer the question specifically, we will be starting very shortly testing asymptomatic employees' family members, like St. Joe's is. We have been actively sorting out our staffing, and I believe you will be getting a communication very shortly about when we're starting the program. So we are pleased to offer this for our employees and their families to ensure that we're looking after our people. And as I say, this will start very shortly. There's been a few days delay trying to secure staffing in the assessment center, and I'm hearing that we're pretty close to having that sorted out. So thank you for the question, and stay tuned. You will be getting notification shortly.
Sounds good. Thanks a lot, Wes. So next question here is from Karen Ellis, who's asking about masks. Specifically, are staff or will staff be required to wear hospital grade masks? I know many right now are wearing homemade masks, but will we be striving to have everyone in the same caliber of masks? So maybe Kelly Campbell, I can call on you for this question. Can you give us some insight on the mask protocol and how this might proceed?
Yeah, absolutely, Aaron. So there's been lots of communication on this corporately, and it depends what site you're at. At all of our clinical sites, our 5 hospital sites, staff are required to wear a medical grade hospital issued mask. However, at our non-clinical administrative sites, such as King West or 293 Wellington, staff are allowed to wear a cloth mask, and those obviously we're not recycling, those can be washed. So it really depends on what site you're at, based on the type of mask that you'd be wearing.
Gotcha. And while I have you in the hot seat, we did get a question that I think you'd be best positioned to answer. This came through the inbox after the last virtual town hall, but about our hand sanitizer. Specifically, the question was, where are we sourcing it from? Is that domestic, or I guess there's perhaps an understanding that some is from overseas, or where does it come from?
Yeah, so we've been buying hand sanitizer for months now, and in some of the very early months of the pandemic, Canadian manufacturers had not yet ramped up to produce hand sanitizer as they are today. Many distilleries have converted, et cetera. So we did have our very first batch of the 7 different lots that we've bought come in from overseas, but now we are buying all Canadian, and in fact, we're buying some locally made in Hamilton as well.
Oh, wow, that's really great. Thanks for that. And it's nice. I've used the stuff around at our site. Better than what we have at home. We went with the cheap tequila smelling hand sanitizer at home, which makes our whole family smell really interesting when we're in the car. Next question up here from an attendee is again about testing. I don't know, Wes, maybe you can add some insight on this one, but staff who have had an exposure but are asymptomatic, should they be seeking testing? like, I guess you think of a scenario where maybe somebody that, you've had contact with, you don't have any symptoms yet, but you're wondering about getting tested. What should people be thinking in that regard? And I see Dave's on video
yeah,
too,
maybe.
So maybe he wants
I'll let Dave start because this is an employee health question,
Yeah.
and I can supplement. Thanks, Dave.
Okay, thanks a lot.
Yeah, no, so there's no change there. So as part of the normal contact tracing protocols, if a staff member has had exposure, then we would expect to have that testing occur. And if you have had an exposure either through work or not through work, you should be contacting Employee Health Services, and that process would kick in.
Okay, good stuff. Thanks for that. I have here another question from Barbara Kabilius about virtual care, and maybe Bruce, maybe you could give us a little insight on this. Specifically, the question is, are we going to be investing in equipment? I know we're doing early work around strategy. I know things are happening, but maybe can you comment about how we might need to outfit some of our spaces in a different way, given webcam, speakers, et cetera, in order to enable virtual care as we move forward with the planning?
Yeah, thanks very much, Sharon, and thanks, Barbara. Great question, and certainly we are constantly investing in equipment across the organization. So Dave McCaig may want to specifically comment in follow-up, but the virtual care task force and the operations team absolutely has part of their mandate to develop recommendations, as I said, for an enterprise approach to virtual care going forward. And that's a short-term kind of deliverable for the task force. And there's no question that part of that is going to be, what do we need to do with respect to the systems, the tools, and the resources, in addition to the processes. So we'll have recommendations there, but exactly what that'll look like, what the magnitude will be, where it will be, is part of the kind of the work that the task force and the operations team are going to do over the coming months.
Good stuff. Thanks for that answer. Dave, another question here about testing. Maybe you could expand a bit, just looking to understand what might be the case for a staff member who needs a test to visit a family member in long-term care. Is there any different consideration for that circumstance?
There might be. I believe Susan might be on the line now, and she might have some insight into that one. That does fall, though, I think, more into the realm of public health, because you're acting more now as an individual looking to visit a family member. It's not related to your workplace. But Susan, do you have any insight on that, or is that one we should take away and follow up on?
Let's see if we got a Susan here. No. Okay. Well, we can do that too. Yep. Yeah, we'd want to be as accurate as possible. So we'll do a little bit of a deep dive on that, and we'll get back to
yeah. I do suspect the answer is going to be you would just follow the protocol that anyone else would from a public health perspective, and seek out a test at a Susan is now texting me. I'm not going to answer that. We'll follow up and get that one onto the hub. All answers, I knew this already. All answers are look to the hub or ask Susan. So there we go. I was right to anticipate that.
We have a process for that to make sure that we're accurate in the information we're providing. So we'll follow that process. It's a great question, and we'll put an answer up on the hub, as is our practice when we can't answer it live and on the spot. So thanks, Dave. I hate to pull you back off a video, but I did have a question of my own. Just curious about flu shots across the organization. I saw Bruce on social media, hugging the annual MPH plushie very tight as he got his flu shot. I'm jealous. So what's going on in this regard? Are they rolling out at our sites now?
You look very cute, Bruce. I previously, unfortunately, had a picture of mine floating around a few years ago, me getting a flu shot, and I did not have a nice stuffy to hang on to. So yes, flu shots are now available at all EHS locations, and drop-ins are welcome.
Awesome. Okay, so everyone get the shot. Let's see here what we have in the Q&A. We do have one here. Any word on bringing back temporary sick benefits for part-time staff if they have been home awaiting results or off with symptoms? Working on an hourly basis can be challenging. So Any word on benefits, sick benefits for part-time workers? I think this is perhaps something that was in the provincial realm, but Dave, maybe we could see if you have any insight for us. And again, if we need to follow up, we can do so.
Yeah, so the two federal ones that I noted are the new ones that we're aware of. The current processes and I get not policies, but just the protocols that we're following with respect to sick and benefits, et cetera, are what has been required. So there was a period of time where there were temporary benefits allowed, and then we were directed to move back to what is consistent, completely consistent with collective agreements. So we're following that, and there's no insights at this point in time that that's going to change. If it does change, we'll be sure to advise staff as quickly as it happens.
Okay, so this is evolving into the Dave show. Dave, don't go anywhere. I've got another one for you on flu shots. Can family members also access the flu shot at our EHS sites, or is that only for staff?
That is a good question, and I'm going to pause and allow Susan to touch on the answer.
Wes is also
it is only for
Wes. Do you have some insight on that?
It is only for staff.
Yeah, but we do have retail pharmacies, and so that may be an opportunity to be explored. I do not have that answer, but we do have retail pharmacies that do the influenza injections. But we'll need to verify that.
Good stuff. Okay, well, we'll do that.
EHS, though, is specifically only for staff. So
okay.
That's it.
Very good.
Yep.
Yeah.
So it is less. The retail pharmacies are waiting for supplies. There may or may not be a supply of vaccine at the retail pharmacy. You certainly can go and ask.
Okay, so what we can do then again, in respect for the question and the information that's needed, we can put that in the dispatch when we know more. We'll also post something on the hub to make sure that when supplies are available, people know about the option of using the retail pharmacies at the sites for family members and employee health services just for staff. So that's great. That's all the questions I see right now. Maybe we'll give one final call. If anyone would like to raise their hand in the participants area, you can ask a question. Or if you'd like to put something through onto the line, a clarification here about EHS. Staff should go to EHS, so they can go anytime for their flu shot. I think you'd pop into the EHS office and see if you can get it on the spot, and then if not, make an appointment. Here's a comment from Anne. I got a flu shot at the JCC retail pharmacy this morning. So great, thanks for the heads up, Anne. So they do have the supplies needed. That's great. This is, we're really getting good at this virtual format, everyone. This, all of our participants and panelists, we're getting very conversational and it's becoming easier to moderate. So thank you. Why don't we turn to our celebrations at this point? Again, you can use the same, you can raise your hand in the participants function or call something out in the Q&A or chat box. I know here I see somebody celebrating the fabulous Canadian procurement of hand sanitizer. Let's keep it in Canada. Also from Sheila Price, thanking for the mention of the respect for screeners, which is certainly welcome and important. Also see a comment, a celebration for leading with the commentary about Joyce Echequan today. So any other celebrations anyone would like to add to the mix? Now is the time to do so. Something that you've seen, something that you think is important. Appreciate Dave's reminder for respect for screeners. Another shout out for that. Wonderful. I see Dr. Michael Stacey here. Michael, why don't you go ahead?
Yeah, thanks, Aaron. I just wanted to sort of shout out to all of the people who are involved with the work at the West Lincoln site. A lot of work's happened over the last few months with the upgrading of the operating rooms, and they're now back and functioning. They're getting the staff required to get those functioning. So a lot of work's been done by teams, both centrally and at the site. So I really wanted to shout out all of the people involved in that work because there's been great work going on. We still have some challenges, but really want to acknowledge the hard work that's been done, you know, by people in the peri-op program and the administration out there, the physicians involved in all of the programs in the OR, obstetrics and gynecology, and also the program for looking after the orphan patients at that site. So great work, everybody.
Thanks very much for that, Michael. So I see here as well, more shout outs to our screeners. One from Morgan Richardson to acknowledge the point of entry screeners, 80 plus new hires made, and recognizing the ongoing leadership from both Cheryl Booker and the volunteer resources team who have been redeployed to oversee multi-site screening. So thanks for that. Shout out to the team that arranged the recycling of masks. That is awesome. Thank you from Trev. And as well, shout out to the screeners directly from M. Any other, oh, I see Bruce there. Bruce, go ahead.
Thanks, Aaron. You mentioned that kind of we collectively are getting good at this, and so I don't think this celebration has been made before, but celebrating you and the entire communications and PR team for the work that you've done to create this this two-way communication tool that I think really does help to support a level of information sharing and engagement across all of HHS. So I did want to make sure that we said thank you and congratulations to you and your team.
Yeah, perfect. Thanks for that, Bruce. I see Ted Scott in there as well. Ted, go ahead. Would you also like to congratulate the communications team, Ted?
Actually, surprisingly, no.
Oh,
actually, I do want to acknowledge some amazing profiles and research that your team has provided through Lisa's work. But actually what caught my initial thought was the amazing work that Katie Porter and Anthony Scandinavo in research had made along with Sasha to provide information about everything that's going on in the form of webinars and so many forms of communication. And just yesterday, we had an amazing talk on vaccines and the development in the current state. So like soup to nuts in terms of addressing the ramp up of research, just really incredible work. So I wanted that to be heard today. Thanks.
Awesome. Thanks for sharing that. I see Kelly has a celebration too, and I just wanted to read out one from Christy Mohide here as well, great suggestion from Christy, again, celebrating screeners. Tough job. Maybe we should all take a moment to thank them the next time we go through in order to help them feel valued and supported. So great suggestion for everyone that's here to think about that. Thanks, Christy. And Kelly, over to you.
Yeah, I just wanted to shout out to the alternate healthcare facility and the many people that are involved in standing that up. Our satellite health facility will start to receive patients next week. And I know there's a lot of down to the wire, both from people in my team, but I know many other teams as well. So they're doing an amazing job and it's taking a lot of time and effort, but certainly well worth the outcome.
Beautiful, thank you very much. Maybe one last call then for any celebrations, either via the chat function or raising your hand. There's still a chance. All right, well, I think we're to be conscious of time. We'll end today's virtual town hall and thank all of our panelists and participants for making time for this. We'll post this session on the hub and distribute it through the dispatch. As always, until the next one, you can ask questions that you didn't get to raise today through the HHS News inbox. Until we see you again, stay safe.